Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.
Hi, my name is Christina Schmidt, Director of Women's Health Operations at North County Health Services, and today we're here to discuss midwifery in the 21st century. And we have special guests here today, Director of Midwifery, Mimi Mateo, and Dr. Esfandiari, our Clinical Director of Women's Health Services for North County Health Services. Welcome, and thank you for coming.
Thank you. Thank you.
So can you tell me a little bit about the NCHS model with midwives and medical doctors?
North County Health Services is really special because we have a collaborative practice, and what that means is that every woman who comes into care for her pregnancy is seen primarily by the midwives, but the obstetricians are available if she should develop any medical complications. I think what's really important to understand about the model, at the foundation for us, we look at pregnancy, labor, birth as a life event, not a medical event. For the majority of women, pregnancy and labor and birth is a normal situation. It doesn't need a lot of intervention. And the midwives are really the experts in normal pregnancy and birth. We bring a special kind of support to women that they are looking for. They want to learn more about what's going on in their bodies. They want to prepare for the experience of labor and birth and for mothering once the baby's here. Now, unfortunately, sometimes women do develop complications. Dr. Esfandiari can talk a little bit about that.
Yeah, especially as we're talking about in the 21st century with obesity on the rise. We are seeing more and more, unfortunately, younger patients having more medical problems like diabetes and hypertension and various other disorders like lupus and joint disease, rheumatoid arthritis. So it's really nice to have this combination of providers so that we can just focus on the medical portion of it, but then the patient also gets the ability to not even focus on that part and be able to focus on her baby and the pregnancy and have a joyful moment and not be constantly told you have to take this medication and do this and do that. It's nice to be able to detach and just enjoy your pregnancy and the baby.
That's great. So the patients get to stay in the practice even with some of those high risks medical conditions that you talked about.
Absolutely. I think that that is the beauty of the program, is that we do what's called a co-management, where the midwife focuses on the routine prenatals and their labs and ultrasounds and what's the name of the baby going to be, what's the gender, and then the doctor can focus more on how is the medical problem doing, how's your diabetes, how's your blood pressure controlled, and are you taking your medications for your blood pressure. And I feel that it is a really good way on focusing on the pregnancy without really pathologizing it, without really making it into a problem.
I think first and foremost, any woman who's ever been pregnant, regardless of any complications she develops, her primary focus is about what's going on in her body and welcoming her baby and the huge life changes that's going to bring. So we want her to absolutely have the medical attention so that she will stay safe. And of course, that's what every woman wants. So we really have a shared goal with the patient, the doctor, the midwife, and our outcomes, I think, speak to that.
Great. Can you tell me a little bit about the hospital part? Are the midwives allowed to deliver in the hospital, or are the doctors there?
Yes, so all of the midwives are midwifery training. If we back up a little bit, at North County Health Services, we're certified nurse midwives, and so We're all nurses with advanced degrees to manage the pregnancy and the labor and the birth. So a midwife is with the woman from the moment she comes in labor until the baby is successfully transitioned. And most women in our population, that means they're breastfeeding. If a problem arises during labor, there's always an obstetrician on call. If a woman needs a cesarean birth, the midwife goes in and assists the obstetrician for that birth. If it's a normal birth, it will just be the midwife and the hospital nurses.
And because we have that co-management from the very beginning of the pregnancy, there is that trust built between the midwife and the doctor. So that is why the midwife is able to do the labor and help the patient, because the doctor is kind of in the background just monitoring the medical problem, where the midwife can really help mom with that important part of labor and transitioning into becoming a mom.
That's great. So there's always a myth out there with midwifery care. And are there allowed to be medications? Are midwives allowed to medicate?
Absolutely, absolutely. And we have preparation for coping with the work and pain of labor. Some women choose to labor and deliver without pain medication. Some women choose to use short-acting IV medication, and some women choose to have an epidural. The midwife is able to order all of those coping practices for a woman, but the difference is if a woman wants to do it without pain medication, the midwife is there all the time, encouraging her to be out of bed and active, changing positions, using the shower. There are a lot other ways to cope with the work of labor if that's the woman's choice. The guiding principle for the midwife is to educate and then support a woman in the choice that she makes that's right for her. And I would say currently about 30 to 40% of the women who deliver with us choose to have epidural anesthesia.
Great. Sounds like they're really supportive, you know, through prenatal care as well as at the hospital and through delivery.
Absolutely.
That's great. Can you tell me a little bit more about the comprehensive services that are offered within the prenatal program? What other?
So North County Health Services is fortunate because we have a lot of experts on our team. We have registered dietitians, we have dentists, we have childbirth educators. I know there's part of childbirth education that's very important to Dr. Sfandiari.
Yeah, we are very proud to be able to support moms who like to have vaginal deliveries after a cesarean section. So there is a whole segment dedicated to the women who choose to do that, and what it's called is they have a separate class that they go to, a separate childbirth class where they learn about the pluses, the minuses of having a vaginal birth versus a cesarean, some of the risks involved. And we pride ourselves in that program because it is really important for a patient to make a decision that she's happy with and makes an educated, safe decision. It's important for them to feel that they're making the right decision and they really are believing in what they're doing. So we are very, very proud of that particular class that we provide.
Well, thank you both for your time and speaking today. We're going to actually take a quick break.
Will spend 15 minutes watching online videos like this one.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes twice a day. They have the time.
Hi, welcome back to Midwifery in the 21st Century. We're going to be discussing the psychosocial aspect of our program, and I have a special guest here today. I'd like to welcome Dr. Rosa Cortizo. Hi, welcome. So can you tell me a little bit about how you support our patients at North County Health Services?
Hi, Christina. Thank you for the opportunity to talk a little bit about my piece of the program. I am the psychologist, the high-risk psychologist for the women's health program, and moms are referred to me by the doctors and the midwives with multiple problems, challenges, and events. So I take the opportunity to do a little bit of attachment repair and work on parenting concerns that the moms may have. Some moms are really prepared for pregnancy and they have been wanting it, and some moms just are surprised by the experience and by the information that they are pregnant. So, but what I always keep in mind is that the baby, it's already in the room, and I educate the moms that we're gonna practically work on a model that it embraces the baby. So we're gonna do in utero developmental guidance and prenatal care throughout. And moms are really excited to kind of honor that the baby's already in the room and that we're gonna be part of the parenting preparation. It's to work with the ghosts in the office, which are all those multi-generational challenges that the moms had, and now we have the opportunity to work through.
Great. Can you tell me how you support the moms in preparing for delivery?
That's such a good question. We have moms are as they progress, and by the end of the second trimester, our moms seem to be a little more anxious. Even if they are excited, they are anxious. There is a group of moms that want to be prepared for delivery, and they want to do relaxation techniques, and they want to talk about their feelings. They want to have a delivery plan in place. But they're a group of moms, a small group of moms that have had a very difficult experience in a previous pregnancy, or they have a lot of pressures. And I tell you, the social media, it's a blessing in disguise in that it's a double sword. It gives a lot of information to our moms, but also makes them very anxious about the forums, because it's a lot of information that it comes from mothers that didn't have a good experience, the moms that are excited and have a great opportunity to be with the baby and everything went well. They usually don't take the time to tell the world. We usually have moms that have difficulties. So we have moms that are getting ready to deliver that are a part of those forums, and then they come with a lot of questions and a lot of anxiety, plus a lot of things that some moms had difficult, C-sections, or they did okay at the end, but they just have that experience, that taste in their mouth. So what we do as a group, we kind of reprocess with the mom and rewrite the experience. We edit the experience. But what I do personally, professionally, and personally in the session, it's to install hope and let the moms know that it's going to be different. And I use a model that it's called EMDR, and it stands for eye movement desensitization and reprocessing, in which we bridge and connect the current experience to the past difficulty and reprocess it so that it's bearable, doable, and the mother is excited again about this new journey of hers, that new project in their life for her and her family.
That's great. How about after delivery or postpartum? Are you still able to support the mom?
Well, this is one of the most exciting parts of the program for me, because I know that we all are very connected, and as a team we collaborate closely in providing support to the moms that are pregnant. But very few programs I'm aware that provide support to the moms right after, and for as long as the mother is ready to let go of the program. So we support the mom from the beginning and the baby that it's already in the room to when the baby is out and is still in the room, and throughout maybe the first few months of the baby and the mom with the baby. So I do have multiple clients that continue to come after delivery. So we assess for postpartum depression, and if there is a postpartum depression, which is not so uncommon. You know, we provide services, support, referral, resources. We follow up the mom to make sure that she's feeling better. We provide referrals to our behavioral health if they need that extra support and an evaluation from a psychiatrist to make sure, because there are those cases that need that psychiatric support. But for the most part, mothers do very well, and they really utilize the service after they deliver. And sometimes I tell them, you know, if after a few months you feel that you need to call us, please feel free to call us back. I will, even if you know you're not in our program, we will attend to your questions, to your needs, and we will provide appropriate referrals.
That's great. Well, thank you very much for joining us today. We're going to take a quick break.
Alvin and the Chipmunks want to remind you, bacteria can hide in food and make you ill.
Wow.
But you can keep bacteria from ruining your day with 4 simple steps. Clean.
I'm waiting for the rinse cycle.
Separate. Cook.
Fire in the hole!
And chill.
We chipmunks are notoriously tidy.
Check your steps. The road trip to food safety starts at foodsafety.gov.
I never chew tobacco.
I don't drink much.
Never smoked a cigarette in my life.
HPV. Isn't that about cervical cancer?
What does that have to do with oral cancer?
HPV? Didn't know that.
Hi, welcome back to Midwifery in the 21st Century. We have a special guest today, Nicole Esposito, a former patient of our midwifery program and also a doctor at North County Health Services. Welcome. So why did you choose our midwifery program at North County Health Services for your care and delivery?
Well, as a doctor at North County Health Services, I have inside information regarding how strong our program is. I think also as a physician, I'm increasingly aware of the risks of increased intervention if it's unnecessary. As our healthcare system grows so large, not only do you have to be careful to make sure that you're getting the regular care that you need, but you also have to be careful not to get too much care. I think people are less aware that that is